Okay, we should be good to go here. Good morning, good afternoon, whenever you find yourself listening to this lecture. I appreciate you tuning in. My name is Dr. Lyle Pavuk. I'm a physical therapist over here at Sharp Coronado Hospital. And what I'd love to talk to you guys today is about the relationship between sleep quality and sleep quantity, and also the experience of pain. The title of this presentation is Sleep and Pain, Understanding the Connection and Steps to Attain Optimal Sleep. Because while it's important to understand the connection between sleep and pain, it's also extremely important to understand how can I optimize my sleep, or particularly if we find that we struggle with sleep in our life. So a little bit about myself. If you've never been to one of my lectures in person or haven't listened to one of my webinars, I like to always start with my personal mission statement as a professional, and that is to empower others to take control of their physical and mental well-being in order to live their best lives. It's very important that people understand they have a lot of control over their health and over their quality of life. And so one of my big passions is helping people to understand that control and how to utilize different tools to optimize their health. A little bit about my background and my education and qualifications. I have a Doctor of Physical Therapy degree from the University of Miami, Florida. My bachelor's degree was in education. I taught high school English in a past life. I have what they call a CSCS, so I'm a certified strength and conditioning specialist, which is a very high level certification related to personal training and strength coaching and things of that nature. I have a certification in APHPT, which is Applied Prevention and Health Promotion Therapy. So basically understanding health at a population level and how we can make different changes to people's behavior in large groups and large populations to help improve overall health. And then, of course, as mentioned before, I'm a practicing doctor of physical therapy at Sharp Coronado Hospital. Our today's learning objectives, we've broken it down into 5 different things. I want you guys to leave the lecture with these 5 things. First, understanding the prevalence of sleep disturbance and how much sleep is perceived as valuable in our society. We want to understand more about the science of how sleep and pain are interconnected and related. We want to learn about the vast benefits of optimal sleep on both the pain experience, as well as many benefits for our general health. We're going to discuss my top 10 tips for optimizing sleep quality. And then the 5th is we want to learn additional prevention strategies to reduce the likelihood you or the people you love will experience pain in the muscle and joints of your body, both acute pain, but also chronic pain as well. So let's start with how prevalent is this issue of sleep deprivation in our society in the United States. And what we see from this Center for Disease Control data is that about 1/3 of adults, US adults, experience sleep disturbance. And if we look at California specifically, we fall right into that 32 to 35%. So again, right about 1/3. And with this study, short sleep duration was defined as less than 7 hours of sleep in a 24-hour period. And we'll talk about sleep guidelines and how much is recommended in a few slides here. But anything less than 7 hours is considered short sleep duration or sleep deprivation. And globally over the United States, this rate of sleep deprivation fluctuates between about 28% and 44%, depending on the geographic location and the demographics of those populations. You can see in the Midwest and in the South, the rate of sleep deprivation is a little bit higher. But over here in California, we're not doing quite as well as some of the other states, such as Colorado and Utah. And our neighbors up north in Oregon and Washington. So again, we sit in that 32 to 35% category. And in America, how much do we value sleep? This was a study by the National Sleep Foundation. It was a survey or a poll that was done in 2018, looking at the major priorities of different Americans around the country. And you can see that sleep was pretty low on the priority list at about just 10%. for whatever reason, we don't seem to value sleep in our society. And my hope is that at a minimum from this lecture, you take away some extra incentive and motivation to try and prioritize sleep in your health picture and in the control you have over your health outcomes. Okay, so now we're going to start getting into the relationship between sleep and pain. And what we find in the research and the data related to this relationship is that it is a bi-directional relationship. Hence why you see the double-sided arrow in the slide, where sleep actually influences the experience of pain, but the experience of pain also influences our sleep quality. And we're going to dive into that nuance here. But before we do that, and if you've been to some of my lectures in the past related to muscle and joint pain and the science of muscle and joint pain, we're going to have to do a quick review. This will help us understand why sleep influences pain, because it is not so intuitive. It requires a basic understanding of how pain works from a more modern perspective. We have a lot of misconceptions about pain. So we're going to try and boil this down in a much quicker time frame than in some of my other lectures, but we'll try and just get the basics down. So the biggest thing to understand about pain is that pain is an alarm system. It's the brain communicating with our consciousness and letting us know that something's not quite right. It's like an alarm going off, like a smoke alarm. And this is a helpful analogy I use with a lot of patients, almost on a daily basis, of we take a glass of water, right? And the production of pain from your brain is like filling a glass with water. And there are many variables that can add water into that glass. You can take altered tissue states. So tissue damage is only one factor. You can have poor sleep or not enough sleep. That can add more water in the cup. Low physical activity or sedentary lifestyle, that adds more water into the cup. We can have poor nutrition and a poor diet. We can have high levels of stress or depressive symptoms. We can also have behaviors like smoking or excessive alcohol consumption. All of these behaviors and biological factors can add water into that glass. And at some point, that glass is going to overflow. And that is when the brain starts producing pain as a protective response. Again, just a basic analogy to kind of lay out how these different factors can influence your pain sensitivity and the experience of pain. This next slide is going to more demonstrate in a graph format how pain works. I wanted to draw your attention to the top left portion of this slide. And what we see here is a depiction of someone who's not currently experiencing pain. So you can see that squiggly line at the bottom, and on the right, it says their normal excited level. So that's basically the stimulus that our brain is processing throughout the day of movement and pressures, different temperature changes, and all these other experiences we have and senses that we have. And you can see at the top left there, it says firing level, and there's a dashed line. Now that firing level we can call our pain threshold. You can see there's a lot of space. It says lots of room for activities. There's a lot of space between that squiggly line, the normal excited level, and the firing level at the top. Now, if I draw your attention to the top right of this graph, this is someone who is currently having a pain episode or a pain experience. And we can see that that squiggly line has now moved up quite significantly, and it says extra sensitive. And it's much closer to the dashed level, the dashed line saying firing level. You can see there's much less room for stimulus before the pain response is enacted by your brain. Okay, so this is an example of neural sensitization. The nerves around your body are more sensitive to pain in a specific location, such as low back pain or knee pain or neck pain, you name it, okay? Now, the important takeaway from this slide is on the bottom portion where we can see that that squiggly line can be reduced back down to a more normal level. And there are a lot of things that can help us do that listed there. knowledge about pain, exercise, relaxation, and breathing techniques, graded exposure, which is basically, taking someone who has pain with a specific activity. Let's say someone with back pain has pain with bending forward to lift something from the floor. That's a very common experience. And basically, graded exposure is exposing someone to that movement of bending, but doing it in a way that's tolerable. And the more they do it and practice it, all of a sudden that doesn't bother them quite so much anymore. One thing that's missing from this list is improving sleep quality and sleep quantity, and it's a shame it's not there, because the science shows very clearly it's an important factor, particularly with people who are experiencing chronic or persistent pain. So again, the big takeaway about pain is often more about sensitivity than it is about damage. It's more about the sensitivity of our nervous system, the nerves in our body, and traveling through the spinal cord and into the brain. It's more often about sensitivity of the nerves than it is about actual tissue damage. So let's start getting into some of the research relating sleep and pain. So this was a systematic review that was done by the American Pain Society in 2013. The title, The Association of Sleep and Pain. It's an update and a path forward. And what they found from looking at hundreds of studies and trying to analyze the data and come up with just a few conclusions was that sleep impairments reliably predict the new onset of chronic pain, as well as aggravations of existing chronic pain, as in making a current pain experience more intense or more aggravated. Sleep impairment, the other conclusion was that sleep impairment is more reliable at predicting pain than pain is predictive of sleep impairment. So again, there's that bi-directional relationship between sleep impairments and the pain experience. And what they found in this research was, in fact, that sleep impairment could predict pain more accurately than pain could predict sleep impairment, which is an interesting finding. I think many people would think it would be the opposite. So again, the relationship, that bidirectional relationship, we see that sleep actually is more valuable at predicting pain than the opposite. Now, that's not always the case, but generally speaking, it's a little bit more accurate. Okay, so another systematic review. This one was done by the Journal of Sleep Medicine. And what they found, according to the majority of studies, and they looked at both human and animal studies, was that sleep deprivation increases sensitivity of a current pain episode. Sleep deprivation may also increase the likelihood of experiencing a future pain episode. So if someone has a sleep impairment, we may be able to predict that pain might not be too far off in the horizon. And then the last conclusion was that due to the bidirectional relationship of sleep disorder and chronic pain, they may influence and maintain each other. And again, that's just a fancy way of depicting that vicious cycle between the two things, sleep deprivation and the pain experience. And then the last study I want to talk about was more of an actual laboratory study with an online component as well. And we'll talk about the components of that. This one was done by the Journal of Neuroscience. And the title was The Pain of Sleep Loss, a Brain Characterization in Humans. And basically what they did in the laboratory portion of this study is they had 30 subjects. And what they had them do was they would come into the lab and have an uninterrupted night's sleep of between 7 and 9 hours, I believe it was. And the next morning, they would be exposed to a warm stimulus that would get increasingly warmer and hotter until they rated it as a 7 out of 10 pain. So they were exposed to a painful stimulus. And then they would rate based on the temperature that they said was painful, they could determine how sensitive somebody was to discomfort. And then what they would do, so after the one night of uninterrupted sleep, about a week or more later, so at least 7 days later, they would come back to the laboratory and they would have an interrupted night of sleep where periodically through the night, they would be woken intentionally and be allowed to do certain low stimulus activities such as reading or using a computer or things like that before they would be allowed to go to sleep again. And so then they, in the morning, would be exposed to that warm stimulus again and rate when it reached 7 out of 10 pain. Now, the online portion of this study, they had about 250 subjects, and they would just take surveys in which they rated the quality of their sleep the night before. In the morning, they would rate the quality of sleep, and then at night, that next day, they would rate their pain experience throughout the day. And basically, the conclusions they came away with from these studies was that even acute sleep deprivation, so one night, not a long like pattern of sleep deprivation, but an acute sleep deprivation from day to day lowered the pain threshold. So that means it takes less stimulus for your brain to produce pain as a protective response. And then the second conclusion was that a similar increase in pain threshold happens with improvements in sleep quality. So the pain threshold would go up with improved sleep quality, meaning it takes more stimulus for your brain to produce pain as a protective response than it would have if you were sleep deprived. Okay, so not only do we see patterns where chronic sleep deprivation leads to increased pain, but actually from night to night, acute episodes can influence our pain experience as well. Okay, now let's start to get into some of the recommendations related to sleep for adults in the United States. And these numbers, these recommendations are from the National Sleep Foundation. So younger adults, 18 to 25, they recommend getting at least 7 to 9 hours of sleep a night. For adults between the ages of 26 and 64, they recommend 7 to 9 hours. And then older adults, 65 plus, they recommend 7 to 8 hours. That discrepancy, I think, is still a little contentious on why older adults aren't 7 to 9, but there has been some research that excessive sleep in older adults may lead to different health outcomes, like increased risk for heart disease or dementia. That might just relate to lack of physical activity. So if you're in the bed too long, it contributes to a sedentary lifestyle. But again, the general recommendations are 7 to 9 hours and younger adults and adults, and then older adults over 65, 7 to 8 hours. Let's talk about why is sleep important. So not only does it help with pain, but I mean, there are a million other great benefits to getting quality sleep, including improving your memory. It extends the lifespan. It can boost your creativity. It strengthens your immune system. Your immune system works more efficiently when we're getting proper sleep. It will reduce your risk for depression and improve physical performance. Such as physical performance with daily activities, climbing stairs, squatting up and down from chairs, or if you're an athlete or of any kind, it's going to improve your performance. It can sharpen your attention, reduce stress, help your body heal itself if you've had an injury. It also helps you lose weight by helping you regulate your hunger hormones and appetite. And it can help, obviously, it helps make you more alert, so making you less prone to having an accident, a car accident, or trip and fall, or something like that. And then let's talk about more health and performance benefits of sleep. Getting sufficient sleep actually helps you reduce your risk of developing nearly every major chronic disease and comorbidity. So the major ones being obesity, diabetes, heart disease, cancer, depression, and dementia. If you get quality sleep, your risk of having any of these chronic diseases goes down, which is obviously a huge benefit. Okay, now the top 10 tips to improve sleep quality. Let's dive in. The number one thing is getting exercise, regular physical activity. It is the number one intervention for improving sleep quality. It's better than any pills or supplements out there. So the recommendation in regards to exercise and physical activity is you want to get at least 150 minutes of moderate to vigorous exercise a week, and that will help you to fall asleep and to sleep more soundly. And you can see the woman in the picture walking her dog. This is a little timely appropriate here during the COVID-19 pandemic. You know, if you are going to be outside, I ask you, please, you know, wear your masks, try and stay at least 6 feet away from people, wash your hands before and after leaving the house, try not to touch your face. I got to touch on these things just because they are important. And getting back to the exercise recommendations, it's in that second point you see there. It's very important to remember that if 150 minutes a week seems daunting, remember that any amount of physical activity is better than none. And the science is very clear on that. So, getting 100 minutes a week instead of 0 is significantly important. So just try and get as much as you can. And, general recommendations are to try and start small and gradually increase how much physical activity you get. It'll become a habit and things of that nature. And then the last point is choose any form of exercise that you enjoy and you can continue to perform long term. People ask me often, what is the best form of exercise? And the very simple answer is the one you'll do. Certain exercises are better for different goals, but generally to get the health benefits of exercise, the most important thing is that you're moving and you're moving consistently. The second tip is to establish a relaxing bedtime routine. This can be anything that you prefer. It could be a warm bath, reading a book, meditation, stretching or yoga with breathing exercises, deep abdominal breathing on its own, or diaphragmatic breathing, as we call it, belly breathing. You can practice imagery with breathing techniques as well. Progressive muscle relaxation. Just try and find whatever works for you. And the research has shown, if you have that relaxing bedtime routine, it kind of helps get you into sleep mode. It prepares the body and establishing a habit, Number 3, try and avoid caffeinated drinks and food for at least 6 hours before bedtime. The most common examples are coffee, tea, and soft drinks. So caffeine can make it difficult to fall asleep and increase the number of times you wake up during the night. It's important to understand that caffeine can take up to 12 hours to fully leave your system. So that's quite a long time. And then it's also very important to remember caffeine is a diuretic. And basically what that means is it's going to make you have to urinate or defecate. A lot of people know after they drink coffee, it makes them have to use the restroom. So, keep that in mind, trying to avoid caffeine late at night. Number 4, you want to try and avoid stimulating electronic devices at least an hour before bed. That blue light that's emitted from laptops, computers, your cell phone can mess with your sleep hormone production, such as melatonin and other factors. The other thing you can try, if for some reason you have to be on your device late at night, you can at least switch your phone to nighttime mode. And what this will do is it will reduce that blue light emission, which again can cause effects on your body's natural sleep hormones. Number 5, trying to avoid drinking fluids or eating too close to bedtime. Drinking fluids is a little more obvious in that, drinking large amounts of water before bed will increase the odds that you will wake at night to urinate. So my practical recommendation is try to get your daily water intake in at least 3 hours prior to bed. So you don't want to not drink enough water. You drink your water, but just make sure it's timed in the morning and the early afternoon. Try and make sure that you drink it at least 3 hours before bed. That'll give you an opportunity to empty your bladder prior to going to sleep. Try and avoid eating too close to bedtime, because eating stimulates the digestion process and it can make you uncomfortable, especially if you suffer from acid reflux and different gastrointestinal issues. Particularly, you want to try and avoid spicy or citrusy foods late at night. And then a very important one too, that could probably be its own sleep tip generally, is trying to avoid alcohol consumption. Some people use it as a crutch to help them fall asleep, and it may help you fall asleep, but the research shows clearly that it harms sleep quality. So while you will be asleep, your sleep quality will be significantly reduced, and you will likely feel much more tired in the morning and throughout the next day. The other thing to remember about alcohol is that alcohol is also a diuretic, similar to coffee and other caffeine. Alcohol will increase your frequency of urination, and it will wake you up at night to have to urinate. Let's talk about naps. A lot of people really like naps. One important thing to remember with napping is you want to really try and limit it to 15 to 30 minutes. You don't want to take multiple hour naps, because naps may, if you look at the point there at the bottom, naps may help reduce daytime sleepiness. But if we nap for too long, if we nap for too long during the day, it may interrupt our nighttime sleep schedule or harm the quality of our nighttime sleep, which is, again, very important to get that continuous at least 7 hours at night. We don't want to interrupt that. It's very important for brain function and our global health, as stated before. Number 7, make sure the room is at a comfortable temperature. It can be quite difficult to sleep. We all know this. It can be quite difficult to sleep if you are too hot or too cold. So use the different tools that you have. Use your thermostat, blankets, fans if it's too hot. Open, close the windows as needed. Try and use all the tools you have to make sure it's nice and comfortable for you. As we can see, Snoopy here having a hard time sleeping on top of his doghouse. And the other important thing there with the asterisks is also, if brightness in the room is an issue, use a sleeping mask or blackout window shades. Some people have an altered sleep schedule because of their work. Maybe they work night shift, or they just tend to be a night owl and they prefer to sleep from maybe midnight to 8 a.m. instead of 9 p.m. to 5 or something like that. So use a sleeping mask or blackout curtains to allow you to sleep while there's daylight out. Number 8, do not sleep with pets. I know this is very challenging for some people, but it's very important, because pets often move around in their sleep or they snore, which can wake you. And at a minimum, it can help reduce the length of your REM cycle sleep, which is important for recovery and all those other things. They also make the temperature of the bed too warm, which can interrupt your sleep. And it's important to realize that just the general movement of the pet in the bed can interrupt, not fully wake you, but make your sleep less quality. So that's important to remember. Maybe it's not waking you up, but it may very well be reducing the quality of your sleep. Number 9, you want to only use your bed for sleep and sexual activity only. And this kind of goes with that bedtime routine, in that we're training the brain to associate our bed and laying in bed with sleep. You can see the gentleman here having quite a few snacks in bed and looking pretty lethargic, actually. So maybe that's one of the reasons he looks lethargic. But you want to avoid eating or working or watching TV in bed. This will help this will help train the brain that if you are in bed, it's time to get some restful sleep. That's what the bed's for. This can absolutely be a part of establishing a bedtime routine, as was discussed in tip 2. And then number 10, if you are unable to fall asleep within 20 to 30 minutes of getting in bed, what you might want to consider leaving your bed and going to do something relaxing, anything of your choice. This is especially important if you feel yourself becoming anxious or frustrated about not being able to fall asleep. It is better to try and stay relaxed and return to bed when you're feeling sleepy. Remember, it is better to take 30 minutes to perform a relaxing activity and fall asleep sooner than tossing and turning with frustration for several hours. And then a bonus tip for you guys is that you can try using a sound therapy pillow, a white noise machine, or a fan if that white noise helps you relax. So what you can do is, if you're interested in that, you can search for a sound therapy pillow on Amazon or Google, and a sound therapy pillow can play relaxing sounds such as rainfall or waves and things like that. There's also many applications you can get on your phone. So if you search in the application store on your phone for white noise, you can find applications that have all those same things. They'll have like fan noises, ocean waves, rain, river streams, and things like that. And they're pretty cool. So, some people like that white noise. It helps them relax. So just some cool tips on that end. Okay. One of our other goals for this lecture was to discuss other strategies to prevent the onset of pain. So what you want to do, you want to make sure you get at least 150 minutes a week of moderate to intense physical activity. And that can be anything that you like. So again, strength training, cycling, brisk walking, trying to get the heart rate up a little bit, right? Jogging, swimming, hiking, anything that you enjoy. And you can do a combination of those things. Again, exercise is huge for improving sleep, but exercise has great evidence. It has very strong evidence for helping with muscle and joint pain. I use it every day as a physical therapist with patients. The second point there, make sure you're eating a nutritious diet consisting of plentiful fruits and vegetables and fewer processed foods. If you want more specific recommendations, I would consult with a dietitian, but general guidelines, try and eat a lot of fruits and vegetables and avoid processed foods. That'll be a pretty good quality diet. You want to avoid tobacco products and excessive alcohol consumption. These things can increase the sensitivity of the nervous system, similar to lack of physical activity and a poor diet. And then the last one is, if you're having stress or depressive symptoms, you want to try and manage that stress with positive coping strategies, exercise, relaxation techniques, social activities and hobbies. And of course, if you do find you're dealing with depressive symptoms or symptoms of some anxiety or other mental illness, it's very important that you remember you can consult with a professional regarding that, a psychologist or a psychiatrist, and that they can really help you in many ways. So it's important to remember that. And then I want to leave you guys with this final thought. It's a quote from E. Joseph Kosman, and that they said was, the best bridge between despair and hope is a good night's sleep. And a lot of people who are dealing with pain or other conditions can feel a lot of despair and a lack of hope. And it's important to remember the power of sleep and other positive health behaviors, as we discussed, with exercise and a healthful diet and managing stress. These things are extremely powerful tools. So if you ever doubt your body's ability to heal and to improve, I would try and use those tools, and you might be very surprised at how good you feel. I want to thank you all for taking the time to invest in your health and for listening to this presentation. And I hope you took away some tips and some good information. Again, please don't neglect your sleep, as it is a very powerful medicine, just like all the other things we discussed. And I hope you guys are taking care of yourself in this trying time with COVID-19. Please take care of yourselves. And thank you again for taking the time to listen. Appreciate it.